That for some women starts in 30s itself, late 30s, after 35 or 38, 39, it will start. See, some of the people have very low immunity and there are certain conditions called lichen planus and all. So that and all, this cosmetic gynec laser treatment does beautiful, remarkable improvement for them. Actually, these days, women are, experiencing perimenopausal symptoms earlier. Menopause, maybe early menopause, andalavaku illa, but yes, I cannot meditate at all. அந்த மாதிரி இருந்தேன் நானு. Now I'm not able to be without meditating. Even if it is just 4 minutes or 5 minutes, it makes a huge difference. If you're a person who's already doing strength training, then great. Then you've literally protected your body well enough, and even after you have menopause, for you to maintain your weight or lose your weight would be easier.
டாக்டர் ஷரண்யா வெல்கம் பேக். டாக்டர், மெனப்பாஸுங்கிற ஒரு டாபிக் வந்து இப்போது சோஷியல் மீடியாவில் நிறையா பேர் பேசுகிறாங்க. இதை பற்றி நிறையா இன்ஃபர்மேஷன் இருக்குது. இல்லை ஒருவேளை நான் 40s இருக்கனால எனக்கு அந்த ரீல்ஸ் வருதா என்னன்னு தெரில. பட் ஹவு டஸ் இட் ஹேப்பன்? அந்த மெனப்பாஸோட ஜேர்னி எப்படி ஒரு உமனுக்கு?
Right. So, menopause vandu actually it has to be spoken more about. Yena vandu they really suffer and they don't know whether this is normal symptom of menopause or not endrathu they don't know. And usually pathingana and the transition vandu usually from the age of 45 it starts and they attain menopause around the age of 50 to 55. But before that menopause is a transition phase called perimenopause. That for some women starts in 30s itself, late 30s, after 35 or 38, 39, it will start. And for some people start by around 40, 45. அது வந்து they will know from the symptoms. Like for example, the mood changes and then the dry skin. Their periods will change. Either it will become lesser flow or it will become a more heavy flow. Then they might have developed some sort of resistance to cold rooms, or even if being in a cold room they'll feel very sweaty. They'll feel very hot. You must have heard the hot flashes. Sleep disturbances where they won't be able to sleep well. They want to take medication to sleep. Then putting on weight. Even though I'm working out, I'm not able to lose weight. And having some cravings for food. So these are some of the symptoms and they don't know whether it is perimenopause or not. இதுக்கு வந்து நீங்கள் டாக்டர் கிட்ட தான் போகணுன்னு கிடையாது. But you yourself will know that okay, slowly life, I mean the way my symptoms are, my menstrual cycles are changing, PMS is changing. So they will know. So that is called the perimenopausal period.
ஸோ இந்த பெரிமெனப்பாசல் பீரியடை டேக்கிள் பண்ணுறதுக்கு நீங்கள் சொல்கிற இந்த மூட் ஸ்விங்ஸ்லாம் ஹேண்டில் பண்ணுறதுக்கு அதர் எனி சப்ளிமெண்ட்ஸ் விச் யூ யூஸ்வலி ரெக்கமெண்ட்?
See, usually supplements is not something that we'll go for first, edutha vidane, because we'll ask them, what is your symptoms? What is it that you're suffering from? So this, when they say that mood swings I have, I'm not able to sleep in the night time, simple things like that, we tell them what type of lifestyle modification they can do. For example, when they say they have dry skin, we tell them that make sure you use a low pH, mild pH body wash or a cleanser, and they'll have lot of vaginal dryness. People come with a lot of vaginal dryness. Because of vaginal dryness, they'll have a lot of vaginal itching that ends up in some sort of infection. So we give them some sort of a low pH equal to the vaginal pH. We give them a wash or a cream. If it is too dry and if it is something that can lead to, there are a lot of other conditions called lichen planus. If it's too dry, then we give them some estrogen creams. That will also be very short-lived creams. We give them this. But lifestyle modification, first thing we ask them is, how is your diet like? Are you taking too much of oil? Are you taking too much of spice? Are you taking too much of sugar or salty foods? Salty foods themselves for perimenopausal or menopausal women makes them feel very bloated. It takes 24 hours for them to, settle down. Especially when they avoid that salt for some time, they do feel better. So we tell them that. Give them a consultation with a nutritionist and according to their BMI, try to give them a diet which is easy for them to either maintain their weight or lose their weight. Second thing is movement. Those who have never worked out, start walking. I never tell my patients go to the gym and start weightlifting, because they do bayangrama, they'll do for a month and they'll sit with some sort of spasm or a strain. Walking is a beautiful magical exercise. I tell them walk for 20 minutes first, make it 30 minutes, take it 40 minutes, then 2-3 months later I'll slowly introduce them to strength training. Do it twice a week.
இந்த இப்போ பெரிமெனோபாஸ் பீரியட்ல நீங்க சொல்றீங்க வெஜைனல் ட்ரைனஸ் ஆகும்னு. டஸ் யுவர் காஸ்மெட்டிக் கைனகாலஜி ஹெல்ப் இன் தட்?
Yeah, it does. That's what actually it does. So when they do have very dry vagina, or if they have some conditions called, see, some of the people have very low immunity, and there are certain conditions called lichen planus and all. So that and all, this cosmetic gynec laser treatment does beautiful, remarkable improvement for them.
All of us in general, there's a shift towards unhealthy lifestyle. Everybody, we are more sedentary, we are eating more junk food. Is it that we are having perimenopause early? Women are experiencing
Yeah,
perimenopause
actually,
early?
these days women are, experiencing perimenopausal symptoms earlier. Menopause, maybe early menopause, andalavaku illa, but yes, perimenopause earlier. But I feel, Rashmi, the awareness on social media is so much that people are really focusing on their health, be it trying to eat healthy. They're very aware what is gluten free food, what are the foods that should be taken, should be avoided. I think in that way social media is
A
done, the
boon.
good side of social media has done a good job, because they are very aware what to do, what not to do, to move around, to exercise. But still, sometimes they need that push, after, especially they see perimenopausal வந்து one more thing is patients feel very tired. They'll feel எனக்கு வந்து I don't want to go to work, doctor, எனக்கு எந்திரிக்க கூட பிடிக்கல எனக்கு, I just want to keep on sleeping. So for them we tell them, how do you go to early to bed, how do you make a lifestyle change, try avoiding the phone screen for 1 hour before, try to avoid your afternoon nap. So in the Mari, we tell them. And when I tell them meditation, first thing they'll say, this is what every doctor says, everybody says, I don't want to meditate, but that really makes a huge difference. Like I cannot meditate at all. And the Mari irundhen nanu. Now I'm not able to be without meditating. Because it just brings this, zen, calm down mode for them. Even if it is just 4 minutes or 5 minutes, it makes a huge difference. So I tell them that do this. So when people come to me with menopausal symptoms, 50% is an advice like a gynecologist, 50% advice is like a non-gynecologist, where I talk about general things. I ask them how their lifestyle is like, if it is going to be completely focusing on family, how you take your me time, weekly off time, it really makes a change. It might be something that இது பொதுவாகவே சோஷியல் மீடியாவில் வந்துட்டே தானே இருக்குது, புதுசாக என்ன இருக்குன்னு சொல்லிட்டு பார்ப்பாங்களே தவிர அதை ஃபாலோ பண்ண மாட்டாங்க. தே ஹாவ் டு ஃபாலோ இட். Small changes makes a huge difference. Sometimes if it is uncontrollable, like vaginal dryness or their hot flashes, then we do give supplements. We do
For
give
hot
creams.
flashes, there are supplements.
Yes, we do give supplements, which does make them feel better.
Doctor, Ipola, no, I've been hearing very often that the excessive use of cosmetics from a very early age actually causes havoc with your endocrine system, hormonal imbalances. Like, how far are you observing such a thing, or is it even there, or it's just a social media thing?
I think, I don't know if there is a concrete evidence for this, but this is all topical. Whatever cosmetic they're using is all topical. So probably too much of cosmetic products on your skin can cause pimples, can cause wrinkles. Yes. But you're not taking, as long as you're not taking anything orally which goes into the system and creates an endocrine disturbance, I think it's fine. Because we do, so many people, we do see many of them who do wear makeup on a day-to-day basis. I mean, I cannot walk out without makeup. I need to put makeup, otherwise I feel like it's bare. So we do put minimal makeup to go for work. And I don't think there's any concrete evidence that it disrupts the hormones. It is only topical. It's only on the skin.
So PCOD, PCOS is
completely
அந்த
not.
அளவுக்கு there's no such.
No, absolutely not. PCOS எல்லாமே வந்து it's a hormonal imbalance which is caused by too much of junk food சாப்பிடுறது. If your lifestyle is not good, if there's not good sleep, if you have, if you're extremely obese, இதெல்லாம் தான் PCOS. சம்டைம்ஸ் வந்து ரீசனே இல்லாமல் இடியோபத்திக்குன்னு சொல்லுவோம், ரீசனே இல்லாமல் சில பேர் ஜெனட்டிக்கான்னு கூட கேட்பாங்க. பட் சைல்ட்ஹுட் ஒபிசிட்டி இருக்கிறவங்களுக்கு, இஃப் யூ ஆல்ரெடி ஹேட் தைராய்ட் அண்ட் இஃப் யூ நாட் கண்ட்ரோலிங் யுவர் லைஃப் ஸ்டைல், இதெல்லாம் தான் ஹார்மோனல் இம்பேலன்ஸ். பை காஸ்மெட்டிக் ப்ராடக்ட்ஸ் டெஃபினெட்லி தேர்ஸ் கோயிங் டு பி நோ ஹார்மோனல் இம்பேலன்ஸ்.
Interesting, doctor. So, doctor, I just want to understand, like, for a woman when she's menopausal, what it is that is the most tough for her to manage, and what is the general advice do you give for menopausal
So
women?
the first two to three symptoms is the most commonest. One is the hot flashes. So we tell them, wear clothing that is comfortable for you. Don't wear something that is too stuffy, and keep the air condition on. Have a hand fan with you. Don't take foods which are too spicy, too oily. And if it is still uncontrollable, we give them supplements for a very short period of time. This is one. Another one is vaginal dryness, like commonly seen. They do have very painful sexual intercourse, and they feel like, every time I have sexual intercourse with my husband, I feel like my vagina is cutting through. That's how they describe it as. So we ask them to use a water-based lubricants. Try with this, lubricate yourself well, and then you have sexual intercourse. So we tell them this. And the third thing is, some of them have this urinary issues, urinary incontinence issues they come with. That depending on the grading of the incontinence. If they need only pelvic floor exercises, we tell them that. If they need treatment, then we go ahead and give treatment like laser treatment.
இப்போ வந்து மெனி பெரிமெனப்பாஸ் அண்ட் மெனப்பாஸில் நீங்கள் சொல்கிறீங்க ஒன் ஆஃப் தி இஷ்யூஸ் இஸ் வெயிட் கெயின் பட் ஆஃப்டர் அ உமன் இஸ் கம்ப்ளீட்டட் ஹர் மெனப்பாஸ் இட் மேபி 45 to 3 years 4 years period then does the body go back to high metabolic level weight loss?
Yeah, I get what you're saying. So என்னன்னா இல்லை பேசிக்லி உங்களுடைய பேசல் மெட்டபாலிக் ரேட் வந்து டிஃபர் ஆகும். இட் டஸ் கம் டவுன் as you are aging. If you're a person who's already doing strength training, then great. Then you've literally protected your body well enough, and even after you have menopause, for you to maintain your weight or lose your weight would be easier. For those who have had a very sedentary lifestyle, immediately after 45 I'm starting na avungalukku konjam kashtamma irukum. Appa of course knee pain varum, avungalukku vitamin D levels low-ஆ இருக்கும். அப்போ அவங்களுக்கு பாடி பெயின் மசில் பெயின் எல்லாமே வரும் பிகாஸ் தே நெவர் யூஸ் டு தட். தட்ஸ் வை ஐ சே ஸ்டார்ட் ஸ்ட்ரென்த் ட்ரைனிங். Strength training, really doing it now will give you protection for the next 5 to 10 years.
There's this huge fascination. Yoga is the answer to everything. I mean, I love yoga myself, but I personally believe that you really have to do weights. Even for women, as far as I have understood, how much I've read, a lot of people tell me yoga pandren adu podum, but I think even if you are doing yoga, you really have to do weights at the gym. It's very
yoga
important.
does help in toning, in calming the body, meditation, in your skin, the oxygenation for all parts of the body. It's beautiful. But to build your muscle strength, and when you build your muscle, there is no insulin resistance, and your hormones are well maintained, your sugar levels are well maintained. So I think strength training cannot be compared to yoga. Yoga has got its benefits separately. Strength training has got its benefits separately. So if you are also doing yoga, continue doing yoga, but also add strength training. At least
What
2
all
days
do
a week.
you do, doctor, for yourself?
So see, I dance, which is my cardio. So I dance 3 days a week, which is my cardio done. And I do strength training 2 to 3 days a week. And I have a lot of issues, Rashmi. I have cervical spondylitis, I have knee pain. So I go to a gym which is run by physiotherapists. So they give me strength training according to this, according to my body. So I do upper body. I do 1 day upper body, 1 day lower body, 1 day core. And it really makes a difference. And when you increase your protein intake, it really makes a difference in your body. Cardio பண்றச்சே ரொம்ப பசி வரும் and you'll feel tired, yes, but when you do strength training, the pumped up feeling it gives is amazing.
Thank you, doctor. It was nice, and I hope a lot of women watch this and get back into their trainers and their workout schedule.
Even
is
if
set.
you can't go to the gym, start some sort of, see, there is now after COVID online classes have started, so start some sort of strength training and get one model from them and buy some dumbbells at home and start
ஏதாவது ஒன்று ஸ்டார்ட் பண்ணா then you're into it. It's just the problem is
once
with
you
starting.
start, அதுக்கப்புறம் நமக்கே வந்து அப்கிரேட் பண்ணணும்னு தோணும். So they will be like, okay, what to do next? Now I need a trainer, now I need to go to the gym. They will do it.
Okay, thank you, doctor.
Thank you.